topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert Show on W4CY Radio and Talk4 TV, where we bring you educational information from experts on such topics as legal, health, financial, and home improvement. Now sit back and listen to our experts in community association law, estate planning law, tax relief, Medicare, public insurance adjusters, neuropathy treatment, business brokers, and personal injury law, along with many other topics. Now here's your host for the last 17 years, Steve O.
In Arizona, one of my favorite states. I love Arizona. Hey, we have got the greatest show for you today. It's only our second show on stem cell. And by your questions and the numbers of people who tuned in last month, this is probably going to be one of our most popular shows. You know, I'm already seeing the questions already pop up already. Everybody has the same question, but we were so lucky to find Dr. Jason DeLuigi. He's with the Life Renewing Stem Cell Center. And I got to tell you, we learned so much from our last show. And we had so many people thanking us. Let me introduce you to our great expert. We're so lucky to have Dr. Jason DeLuigi. Good afternoon, Jason.
Hello, Steve. How are you doing today?
We're doing well. I got to tell you, if I were you, I would be pinching myself every morning when I woke up. Just the fact that you could put on your door that one of your specialties is stem cell, because so many people have questions.
Yes, wonderful. I'm looking forward to answering their questions today.
So tell me all about your practice and your background.
Yeah, so I'm a former U.S. Army physician, and so served for 14 years. And
wow.
I did my original residency at Walter Reed. I did my sports medicine fellowship at the University of Utah. And I've been practicing in regenerative medicine and stem cells and PRP since 2008. So
it's amazing. You know, I've heard about stem cell for years, but before our show, I could not tell you anything about stem cell. So tell people, because a lot of the questions I'm seeing, Jason, coming in is, does stem cell treat acute pain?
Yes, it can. Many times you'll see where most of the literature starts from with the acute pain. There's been a number of the professional study, leagues that would use it. So there's been studies that have been done looking at hamstring tears in the NFL. The Pittsburgh Steelers doctor had utilized some of the stem cells and PRP and regenerative medicine options for hamstrings and compared them back to prior treatments that they were doing and got their athletes back several weeks earlier. So less time on the disabled list, more time playing is always a good thing. So other studies have been done too, looking at shoulder injuries in throwing athletes, Major League Baseball pitchers, Major League Baseball, throwers from that standpoint. There's been other studies that have been done on knee, all for acute. I used to be the head team physician for the Washington Wizards, and we used it and the Washington Nationals. And we used it quite a bit for some of our athletes who we had less than a month to get them ready for the playoffs. But they sustained an injury. And so we were having to treat them acutely to get them better so that they can participate in the playoffs. And they did.
Well, I'm so excited about the show. So a lot of athletes are now using stem cell.
Yes, sir. Yes, sir.
And I want to get this in because I was just talking to you before the show, I'm seeing people who thought they had to go to Mexico to get stem
Yes.
cell. And here you are right in Arizona. Would you mind telling people, because I'm sure you've heard all the stories of people who go to Mexico to be treated for stem cell?
Yes, historically, there were a lot of, professional athletes and everyday people that were traveling overseas. Some initially to Europe, some to Mexico or Panama, from that standpoint. Some of the clinics have been around for some time and have, pretty good reputations, from that standpoint. So, and have had good outcomes. But, as time grows and people see there's opportunity to make money, there are other clinics that are popping up that may not have the same, reputation. So, if you are going to travel overseas, you still can get some good results, but you want to make sure you do your due diligence and homework, regarding, what you'll be getting and, and how long the clinic's been around and, how they've been doing. So from that standpoint, so.
Mason, would you, I mean, Mason, Jason, would you mind sharing with people the kinds of injuries that you're seeing that you're having really good luck with stem cell?
Yes. As time goes on, there's ones that I see more frequently. Many people have, knee pain is one of our, particularly knee arthritis is one, of our biggest, ailments that people come in to get seen for. We also see a lot of chronic back pain that have been doing really well. We do a combination where we do the treatments. If they have, depends on if they have back pain alone or back pain with nerve pain. So we can do some injections of the spine as well as some intravenous treatment IV. And we parallel the back pain also with doing spinal decompressions, from that standpoint. Additionally, our knee patients have been doing well, historically. We are getting a lot of patients who are doing better with workers' comp and occupational health. And so we are having a number of occupational health facilities and workers' comps and patients our way, from that standpoint, so we can get them back to their jobs, and help them. So there's could be a meniscal tear, shoulder injuries, hip, so I see a good bit, as a sports medicine doc, a lot of musculoskeletal, but I also treat back pain. I am also board certified in pain medicine. So I am one of the few people who do back injections, as well as sports injuries. Many times it's either sports or spine. I like to do a combination of both. I'd like to take the comprehensive care of the everyday person, so they can keep doing the activities they like doing, but also, the weekend warriors and the athletes that we see too.
Yeah. Well, I got to tell you, I think it's incredible the results that you're getting. So let me ask you this, because I'm seeing people are asking this on YouTube and on TikTok both. People want to know, so if I come to be treated, this gentleman right here has got low back pain.
Yes,
He said,
sir.
if I come into your office, he said, other doctors I've gone to, it seems like I come out the same way I went in. So how can stem cell help me?
Yeah, so I would have to evaluate each person individually and come up what I feel the best plan may be. Some patients, they have back pain alone. Others will have numbness, tingling, and weakness in their lower extremities. Right. Some of them may have had surgery before. Right. So we're not starting with the same slab of marble. Right. So sometimes it might take a little bit more time for us to chisel a little bit at a time and come up with a more longitudinal plan, for success. So, what stem cells and platelet-rich plasma and the other regenerative medicine treatments have shown, right, is that there's improvement with pain, there's improvement with function. There have been some studies that have also shown some changes in morphology. That means that's what the disc and spine looks like. So so one of the things with degenerative disc disease is you lose water content and your discs start to shrink. And so when you are doing these treatments, you can see that dehydration of the disc, called desiccation, is improved on imaging as well. So from that standpoint. And we also kind of work with a more comprehensive physical therapy plan. And as I mentioned earlier, we also offer patients some spinal decompression should that be of something of benefit for them. So it's not just, there are places that just inject you and send you on your way, but I'm still trained in all, my original training is physical medicine and rehabilitation. So I look, at all of the rehabilitation sides of things. And I really try to give you the most comprehensive, approach that's going to be the best for you.
Do you use laser at all?
You can use laser. There are places we actually have shockwave here at our clinic, which can be used to help with treating some of the joints and tendons and muscles as well. I have used laser in the past. Laser and shockwave work similarly but differently. They're both using sound waves at different radio frequencies, right, that are going to help the tissue. So I've seen good results with lasers. I've also seen a few people at some places, if the person who doesn't know how to use the laser, does it incorrectly. I've seen people get burns. I've seen a professional athlete who has gotten a burn after they're hurt, and she was a WNBA player. She had her knee underwent surgery, and then we treated her with stem cells after the surgery to help her recover. And then she was getting some laser treatments and actually got a burn over that because the skin in the area where her surgery was, she didn't have as much sensation. So she wasn't able to give the feedback that it was uncomfortable. And so from that standpoint, so it caused a little bit of a complication, but overall laser is, typically safe and it's been effective. I always like to say that there are some, cautionary tales that I'd like to say, right? There's with some risks to it, right? So from that standpoint, it has to be used in skilled hands, right? So,
are there different injuries depending on the sport? Like the basketball players have different injuries than football players or baseball players?
Yes, absolutely. There's typical types of injuries, right? There's more shoulder and elbow injuries in a pitcher, for example, right? Than you would get in an offensive lineman, right? So, but an offensive lineman still could have shoulder injuries from blocking, but they also have a lot more knee injuries, right? Foot and ankle injuries are much more prevalent in basketball players, right? But anybody can roll their ankle, right? From that standpoint, but we see a lot more of it in basketball because of all the jumping and cutting that they do, right? So, and there's different injury, based on positions, right? So, a wide receiver or defensive back are more likely to get a hamstring injury than an offensive lineman because they're not sprinting, or not as, if they do sprint, it's not as far as they need to go, right? So from that standpoint, because they're just firing away at the person in front of them unless they're pulling. So
here's a great question we just got. How do you see, first of all, he thanks you. This is from Tucson, Martin in Tucson. Thank you for having a show like this. I bet you there's going to be people who doctors told them that there's nothing they can do, that they're stuck with pain, that you might be able to help. My question is, do you see AI furthering what stem cell does?
I think that that is something for the future. I think that in order for AI to help, we need to have persons train AI, to create those algorithms that can provide benefit. Additionally, I think that, we need, more studies that would be done that would help AI, in the longer term. So I think my ultimate goal is when I look at a patient where I think that stem cells and regenerative medicine and PRP need to be, we need to come up with a range of what is needed for a different injury at different times, right? So if I see somebody with, knee arthritis that's early on, it's different than, having near end stage osteoarthritis. If I see somebody who tears a hamstring, and it's been 3 weeks from the hamstring tear versus the first 3 days, I think there's a different approach with that as well. So those would be the things that I think we need to tease out, as humans first, then we can try to teach AI some of that. But AI can do a lot of good number crunching, right? So from our standpoint, so if we can, collect the data, and so, we do have, where we, talk to our patients if they like to enroll, and where we can track their outcomes, and then we can share that. It's in a shared database, with the other providers in our practice, so that we would all have the outcomes. So if we can find a 50-year-old with a tennis elbow injury from playing pickleball, right? We could compare it to other people that are similar and come up with a very similar treatment protocol.
Martin in Scottsdale wants to know, what is the success rate of stem cell?
Yes. So, I would say most of our patients have success to a varying degree, right? So, we have people that are very, very active in extreme sports. We have other people who play pickleball or golf on a regular basis, right? So I had a cyclist that was in here yesterday who did a follow-up, and she never stopped cycling even though we did her treatments, right? So, and she's a high volume cyclist. So, from that standpoint, just needed another touch up. So, that she didn't have 100% complete relief of pain, but she was able to keep going back out and doing things. We have some people who say they don't feel any pain at all, so we have a few people who started their protocol with back pain and, couldn't stand for 10 minutes in the counter, right? And couldn't walk for more than 10 minutes, right? In a grocery store, and would have to sit down in their rolling walker with the chair in it, so, and they were saying that not only are they able to do that 10 minutes, but they're now able to do 30 minutes, right? And they've had one treatment so far, and they've had 5 decompressions, right? So, and they felt like they've gotten their life back. We have other people who, might be a little bit more chronic, and it takes a little bit more time, right? I mentioned that, everybody comes in with a different slab of marble, and it might take time, to chisel away at everything that's happened. Sometimes you have compensatory changes and muscle knots in your back or in your thighs or your leg muscles or your hips, and contractures. And so we try to look at everything and try to come up with the best plan for you. But overall, everybody has seemed to be, near everybody, has seemed, there are times where we do offer, with different portions where they will have a 50% guarantee, from that standpoint. If you're not getting better in 6 months with a singular body part, we'd offer you half of your money back, or offer you half of the treatments to retreat. Our ultimate goal is to get everybody to feel better, so they can go out and tell everybody on Instagram or, Facebook or YouTube or TikTok, right, and do their videos and show, how well they're doing now. And, because our ultimate goal is to get you feeling better.
This is from Mark. He's writing in from TikTok. He said, I'm sure I missed this. I missed the first part of the show, but I keep hearing regenerative medicine. Yes. What treatments are considered regenerative medicine?
Yes. So different people may give you different answers. So I'll start. I feel that the original regenerative medicine that was coming from the late 1920s, early 1930s was called prolotherapy or proliferative therapy. We talked about a little bit about that on the last episode. So that was when they were using originally high concentrated sugar water. So everything was anti. So they were saying maybe we need to do something that helps our body. So if we have a cough, we give an anti-cough. But why do we have a cough? We're trying to get rid of something that's an irritant, right? It could be a bacteria or a virus or, an allergen, right? So we cough, right? But if we take an anti-cough, we might be preventing our body from doing that. Same with anti-inflammatories. So their thought was pro-inflammatory. And I think the next one that came from that was using PRP or platelet-rich plasma. And so people were using our platelets. And so doing a blood draw and spinning it out and getting high concentrations of platelets. Then you travel into the stem cells. And so the stem cells would be, bone marrow stem cells. There's fat stem cells. And then there were stem cells that can be taken from the placenta and umbilical cord, right? So those are all different types of stem cells and regenerative medicine options. I think that there could be also some of the treatments you had mentioned, The shock wave can have some regenerative properties. Laser can have some regenerative properties. What we're trying to do is, stimulate blood vessels so it can help heal. So if there's a mismatch in, delivery of healing cells because we have poor blood flow there, I think those treatments can help too. They may not be traditional, but I think they're adjunctive regenerative options. So many, we have a couple of my colleagues at Harvard, Adam Tenford and Joanne Borg-Stein have done a lot of literature and research on shockwave therapy that can be done in sequence with or in front of regenerative medicine options, and have showed improvements too. So so it's great experts like them as well that continuing to research and look for the best outcomes for our patients that makes this type of treatment exciting from that standpoint.
I guess this is a great final question. Your show goes by so fast. This is actually from Albuquerque.
Wonderful.
He said, I just found your show. Thank God for your show. I really appreciate what you're doing. My question is, I have severe arthritis.
Yes.
Can you treat me? Since you're so far away, I want to kind of make sure before I come all the way to Arizona.
Yes. What we can do is we could work on setting up, an evaluation, that could be done ahead of time. So we can talk to you if they could like to share their imaging and history. There's the number there. That's our phone number. If they call, they can get the information, the fax, or send us their information, and we can coordinate a call with them to go over and review the specifics. We do see many people. They said there's nothing else they can do but knee replacement, but then they have too many other medical conditions that the anesthesiologist wouldn't even approve them to go under surgery because it's too risky. Then you look at what is the alternatives, right? Is it a life of just being sedentary and not enjoying your life, or is it a life of just taking chronic pain pills, that can be addictive and have other problems with it? Or is there something that we can do that can help you get your life back, and so that you can enjoy the life with the years that you have?
Well, I got to tell you, if I'm sitting out there in the audience, I'm going, hey, because a lot of people are told that this is it, you're stuck with this for the rest of your life.
We do. I see that all the time.
I'm sure you tell people how they can reach your office.
Yes. So they can call at our phone number here that's on the bottom. It's 480-401-2554. From that standpoint, we are also on Facebook under Life Renewing Stem Cells, that you can reach out to us that way through the messenger. But the phone call would be probably the easiest way, because that or the contact us on our website. So from that standpoint. So,
what's your website address again?
I don't have my card right in front of me. I apologize, Steve-O.
I think we actually have it. I thought we just have.
I didn't want to tell if in case I was off by a letter or a number. So I just.
Not a problem. Listen, I got it. And Dr. DeLuigi will be with us again next month. And we're probably going to start replaying his show, because by seeing the numbers, everybody's interested when it comes to pain. Jason, thank you so much.
Thank you so much. I love doing this. I love helping patients. So I really appreciate you giving me the opportunity to reach your audience, that you have an amazing audience. And we've had so many people reach out to us from the first time, and I'm looking forward to other people reaching up to us now. I'm just glad we have you. We'll see you next month. Thank you so very much. You have a great day. Please, folks, give Jason a call, his office, if you've got any type of acute pain. Hey, that's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.